Bismillahirrahmanirrahim. Our lecture today on neoplasm of the larynx, either benign or malignant tumor. Benign tumor like epithelial or connective tissue tumor. The most common epithelial tumor, benign tumor, is papilloma, which are either single or multiple papillomas of the larynx, usually preceded by infection with the Epstein-Barr virus, and connective tissue tumor like fibroma of the vocal cord, condroma of the lung of the cartilage, angioma, etc., and rhabdomyosarcoma. We will concern on the malignant neoplasm in this lecture. The commonest malignant neoplasm of the larynx is squamous cell carcinoma. Other are adenocarcinoma and basal cell carcinomas, syndrome, and other connective tissue disease like malignant lymphoma, etc. Squamous cell carcinoma is commonest among 5 decades of life and more common in male or smoker. Pathologically speaking, the neoplasm or carcinoma of the larynx stems from the squamous cell carcinoma of the larynx, range pathologically from highly keratinized to anaplastic types, and clinically they are growth as ulcerative or proliferative. Biopsy always necessary for both diagnosis and for determining the degree of differentiation on which the treatment is dependent. 3 types of tumor according to the site, either supraglottic, glottic, and subglottic. Supraglottic, where the tumor arises above the vocal cord, usually present with discomfort of the larynx or sore throat, and hoarseness may be relatively late when it extends or involves the vocal cord. This diagram shows parts of the larynx cavity, supraglottic, glottic, and subglottic. This picture shows supraglottic tumor. Also this one, unilateral supraglottic tumor. When involved vocal cords, it will cause hoarseness. Otherwise, present with just discomfort of the larynx. Glottic carcinoma, the commonest type of the squamous cell carcinoma of the larynx. Majority of them shows keratinization. كمصطلح اسمه carcinoma in situ when the tumor confined to the surface epithelium only, without invasion of the supporting tissue. The carcinoma of the glottic carcinoma present on the free edge of the vocal cord or on the upper surface of the vocal cord, usually in the central portion of the vocal cord or in the anterior half. Early presentation due to hoarseness. Usually no palpable lymph node can be found in the area lymph node drainage from the vocal cord itself. هذا الدياجرام الثوري picture endoscopic picture shows white plaque of on the upper surface of the right vocal cord. Spread of the tumor or metastasis forward to the anterior commissure. Anterior commissure هي منطقة التقاء الvocal cords together in the anterior part of the inner surface of the thyroid cartilage. يمكن يكون إلى one vocal cord or pass to the opposite cord. Laterally, the spread go to pre-epiglottic or para-epiglottic space. Backward is the usual spread, easy to backward, and can cause dyspnea. نعرف احنا vocal cords and anterior third of the vocal cord or anterior part for phonation and the posterior third for respiration. Upward extension of the glottic tumor to the ventricular band is late. downward into the subglottic space on the same side or below the anterior commissure anterior. May reach to the trachea. الجلوتيك يوصل للتراكيا، السبجلوتيك يروح للتراكيا، يمكن فوق تروح للسبراجلوتيك فيسمونه ترانزجلوتيك. Rarely lymphatic support. Clinical presentation of the glottic tumor usually hoarseness, increase gradually. Pain usually referred otology, so patient with referred otology لازم نفحص اللارynx مالته. Dyspnea and dysphagia are caused by perichondritis of the thyroid cartilage or any cartilage with the thyroid, مثل cuneiform, corniculate cartilage, arytenoid cartilage, any cartilage involved by tumor cause perichondritis, severe pain, dysphagia, and dyspnea. By direct laryngoscopy or indirect laryngoscopical examination by scope, شوف there's nodular or generalized swelling of the vocal cord حسب extension of the tumor, white papilliferous excrescence or ulceration in the area or as a plaque مثل ما شفتوا بالصورة. Impaired mobility of the affected vocal cord وهذا يسبب لنا hoarseness. Metastasis in the lymphatic gland of the neck as a hard painless mass beneath the sternocleidomastoid fluid is rare. Subglottic carcinoma, non-incidence matters midway between the glottic and supraglottic. Site of tumor in the below surface of the vocal cord and sometimes in the anterior commissure. Direction either upward to the glottic area or downward to the trachea. Lymphatic separate to the lower deep cervical lymph node and to the paratracheal, cricothyroid, brain and mediastinal lymph nodes. Clinical feature of the subglottic usually it's non-symptomatic in early stage. It's late when the tumor extends to the vocal cord can cause hoarseness, or when the tumor growth increase in size to cause stridor. Diagnosis depends on the history, clinical examination, endoscopical examination, radiographic examination, particularly CT scan and or MRI, usually with contrast, including the whole neck, tumor, larynx and lymph nodes, and biopsy. Classification of the tumor. Simply we can classify the tumor in 4 stage or T classification, TNM classification. T to a tumor, either tumor in the glottic or supraglottic or supraglottic. كلهن تقريبا متقاربات من بعض. إذا هسه نشوفهم T1 كلهن limited to one region، يعني لا يصعد للجلوتيك، لا يصعد من الجلوتيك للسوبراجلوتيك، لا ينزل من السوبراجلوتيك إلى الجلوتيك، وهذا كل واحدة بمكانها. T1 limited to one area and mobile vocal cord. إذا نشوفهم كلهن بالجلوتيك سوبراجلوتيك T1 معناته limited زائد mobile vocal cord. ما عدا بالجلوتيك عندنا سواء كان involve one vocal cord or both vocal cord limited بالجلوتيك area يعتبر T1. إذا extend to another area من الجلوتيك راح للسوبراجلوتيك أو من السوبراجلوتيك نزل الجلوتيك أو من الجلوتيك إلى السوبراجلوتيك وهكذا. هنا extend to 2 region صار، إذا صار عندنا نقول T2 with mobile vocal cords. إذا صار fixed vocal cord صار 3 T3. وإذا extend beyond the larynx صار T4. هذه as simple as such حفظوها. and the regional lymph node عندنا either N0 lymph node cannot be palpable, and one palpable lymph node but mobile unilateral. T2 contralateral or bilateral lymph node, mobile lymph node. N3 هو fixed lymph node. Treatment. First line treatment, especially in carcinoma in situ or small tumor, can be removed by laser. Radiotherapy. Radiotherapy for treatment of an insensible or small tumor cannot be reached by endoscope, cannot be seen. Also treat the lymph nodes. If the tumor patient unfit for surgery, or the patient refuse surgery, or the tumor is of anaplastic type tumor or early chordal growth، يمكن استفاد من يبقى الحنجرة مالته ويستفاد منه كجهاز صوت، وبنفس الوقت هو يشافى لأن early chordal growth. والانابلاستيك تيومر قلنا إذا واحد بيشت انفت فور سيرجري نطيب هذا. لكن مشكلة الراديو ثيرابي مو بكل التيومر نقدر نسويه. إذا تيومر extend limitation so demand treatment by partial laryngectomy هذا أو total laryngectomy. and إذا involved أو قريب من الكارتلج أيضا تحاشى الراديوثيرابي. Radiotherapy يمكن أنه يصير combined with hyperbaric oxygen to increase the cancerous effect of the radiotherapy. عندنا شغلة مشكلة الراديوثيرابي السايد افكت مالته أو الكومبليكيشن اللي تسوي لنا necrosis بالتشو. Chemotherapy third line of treatment. Fourth, surgery إذا failed of radiotherapy. وإذا عندنا primary curative treatment يعني هذا المريض نشيله ما عنده لا lymph node ولا عنده metastasis to other region ومثل bilateral vocal cord involvement ومستعد إنه هذا curative treatment surgery يصير. In advanced cases sometimes advanced cases رايح T4 واصل للسكين لا يفيد الراديوثيرابي لا يفيد الكيموثيرابي بنسوي له surgery. Either total laryngectomy or partial. Management of lymph node metastasis limited to one vocal cord one lymph node. Tumor limited to one vocal cord. Now observations usually Marcos lymph node detected in the glottic tumor. إذا التومر early presented with lymph node, patient early presented with palpable lymph node, it is also blocked neck dissection with the surgery of the laryngectomy. Prophylactic treatment for by radiotherapy بالنسبة للفوكال ما نحس يعني احنا ولا شفنا بالليمف نود بالهاي فنسوي prophylactic treatment by radiotherapy to include area و treatment post operative and post radiation lymph node metastasis. إذا سوينا عملية رجعت مرة ثانية metastasis بعد الراديشن أو بعد ال surgery يجي الساعة أيضا نسوي block dissection.